Hello.
Hello.
First of all, thank you for talking to us. How common is lung cancer? Did something change during COVID-19 pandemic in terms of lung cancer cases?
So unfortunately, lung cancer is a very common problem, and the incidence of lung cancer in the Western world is even increasing. In the past, the majority of patients were male, but meanwhile this picture has changed and even more women are suffering from lung cancer. When you ask me about possible changes of the COVID pandemic, I think until now we are not able to give you a clear answer on this. Certainly, COVID has not a direct impact on development of cancer, but there might be some indirect consequences resulting from that. As you know, many patients who get COVID disease are suffering from significant infections in the lung. When they heal, these infections can have some scar tissue formation as a result. And scar tissue formation in the long run is a risk factor also for development of potential cancer. So right now we can't give you a clear answer, but it might well be that in the future we see a higher incidence of lung cancer in patients after COVID infections.
So COVID-19 can increase the risk of lung cancer in some way? Could. I don't say can, but it could. We are unable to give a clear answer right now. But certainly the real risk of COVID is something else. The real risk right now is that people are really getting extremely sick with the lungs, and it becomes necessary that they are ventilated, and even some of them have undergone lung transplantation as a last possibility to save their lives. I understand. But what causes lung cancer? What are the risk factors for lung cancer?
So the number one risk factor all over the world for lung cancer is smoking. The number two risk factor is smoking, and the number three risk factor is also smoking. And then there are coming a couple of other risk factors. You can see from this already that it's very important that you stop your smoking habits if you want to do something good for your health. Of course, a poor environment, bad environment conditions are also potential risk factors. But as compared to the impact of tobacco smoking, they are much less of importance.
I understand, but if we quit smoking, the risk decrease?
Certainly, the chronic infectious process that is resulting from smoking for the bronchi and the lungs is stopped when you quit smoking, and you can definitely again reduce your risk in the long run. Depends how much you have been smoking, for how long you have been smoking, how many cigarettes per day. So really there are different circumstances.
I understand. How a person could know if he or she have lung cancer? There are early warning signs?
There are some signs, but I would say these are not early signs, because when you have signs from lung cancer, there is already, the disease is already established and has a certain dimension already. And this is the problem. The signs that you might see is that you have an increase of coughing. The signs might be that you have some blood in your sputum, which is already a very, very worrying sign, I would say, because it usually shows that it's already an advanced stage of cancer. And besides that, there is also certainly the possibility that you feel that your breathing capacity is decreasing, or you have to have some pain somewhere. These are potential signs as well. Important would be to detect lung cancer as early as possible. So a screening, not only with the normal thoracic X-ray, but rather with a computer tomography of the chest,
within time interval of several years is a very, very potential thing to detect lung cancer early, especially in the risk population of those who smoke a lot.
How can you diagnose the lung cancer?
So the diagnosis of lung cancer, certainly the first step is to perform a radiological investigation. As I already told you, an X-ray is normally only able to detect a tumor when it has already a certain size. Early cancers can only be seen on thoracic CT. So it's much better to do a CT than instead of only an X-ray. And then if you find some shadow which is suspicious there, you have to identify this and you have to find the reason for this shadow. There are also benign reasons there, infections, granulomas, whatsoever. So what you really need to do is you need to get some histology. And for getting a histology, you have to do usually a bronchoscopy, or in a more modern way, there is the possibility to puncture such a lesion from outside with a CT-guided small needle, or the most modern way is to go in with the bronchoscope and have an ultrasound on the tip of the bronchoscope, which allows you to identify the lymph nodes and potential nodules in the lung and biopsy them directly. All that together allows you to get a tissue, because tissue is so important for the further decision which therapy should be offered to the patient.
How long does it take to establish the diagnosis? Because time is very important for cancer patients.
You're 100% right. Time is very important, and there are a lot of different investigations and there are a lot of different solutions that you have there. So it's really important to offer that to your patients in a very comprehensive way. This is one thing that we have here in the Vienna International Center for Thoracic Oncology, called VICTO, that we are offering our patients, that they are, when they come in, we try to offer them the diagnosis and the treatment proposal and the resulting treatment as quick as possible, usually in a few days, less than a week. This, I think, is crucially important to have success in the fight against lung cancer.
I suppose that the earlier the disease, the more effective the treatment. But what about the late stages of lung cancer?
Thank you for the question, but maybe let's talk first a little bit about the standard therapy in the early stages. So certainly for the early stages, a surgical resection of the tumor is the standard therapy. It has always been the standard therapy, and it will always be the standard therapy in the future, I'm sure about that. So a clear surgical resection of the tumor, including the local lymph nodes, is very important. Now you can do this in a minimal invasive way with very small incisions, like 2-3 centimeters only. Or you can do it in a classical way with a little bit a bigger incision. This depends on the situation. And it is not so important for the patient whether the incision is 2 centimeters longer or smaller. It's important that the resection is performed in a very precise and very radical way. Now, this is the situation for the early cancer. But as soon as a cancer has a little bit increased in size, and especially once it has spread to the lymph nodes, it's certainly important that you add to the surgical therapy some systemic therapy as well. And nowadays we do have different possibilities. We have the classical chemotherapy, but we also have, for those patients who do have mutations in their tumor, we have a specific targeted therapy. And we also have, for patients who are potential candidates for immune therapy, the new immune therapy options as well. And it's for the specialist to decide which is the best treatment choice for the patient for the particular situation.
So the surgery can be used only in early stages of the disease?
No. Surgery is the standard for the early stages, but it is part of the treatment option even in the more advanced stages. Not in all of them, of course, but in advanced stages. What you do there is the so-called combination therapy. It's the combination of systemic therapy with local therapy like surgery. And it differs from the situation whether you prefer to offer first the systemic therapy and then, when you see a good response, offer the patient an operation, or you suggest the patient operation at the beginning and thereafter so-called adjuvant systemic therapy, depending on the situation, on the background, on the tumor type.
Can a patient live without one lung if the other needs to be removed during surgery?
There are many patients who are living only with one lung, and if the function of this lung is normal, you can have still a very good quality of life, including minor sports and everything. Certainly, you won't win the Olympic Games anymore, this is for sure, but it's not about this, it's about survival, and it's about getting rid of the cancer. So the removal of one whole lung on one side, so-called pneumonectomy, is something that you should have in your armamentarium of therapies that you offer your patients. Of course, it needs quite a good surgical procedure for this, because this is quite a big operation and you have to perform this with dedication.
I understand. But lung transplantation can be used for cancer treatment?
Transplantation is usually not an option for cancer patients.
Why?
Because the transplantation, for transplantation, it needs to have immunosuppressive therapy lifelong. And immunosuppressive therapy is the contrary that you would like to have when you have to fight a tumor. So transplantation is more or less the opposite situation to a cancer treatment, unless there are a few exceptions. In Vienna, we have done more than 2,300 lung transplants meanwhile. And we do have a small group of about maybe 15 patients who came because the function of their lung was so extremely poor that they needed lung transplantation. And then there was, on top of that, a small localized cancer as well. In those patients where you combine the functional therapy with the oncological therapy, in the very early stages, you can have good results, and we have seen these good results without any recurrence in these patients.
I understand, but can be lung cancer cured because it is an aggressive type of cancer. We all know that.
Lung cancer is a very aggressive cancer, there's no doubt. So it's very important, number one, that you avoid to get it by no smoking. Number two, that you detect it as early as possible. And number three, that you offer the precise and best therapy that is available, whether that's systemic or surgery or combination or whatsoever. And definitely you can cure lung cancer, not only the early stages, even advanced forms, but this really depends on the circumstances, on the type of the tumor, and of course of the choice of the right therapy. So we have seen in the recent past really significant improvements in the results, especially with the combination of the newly available immune therapy and targeted therapy with surgery thereafter is something that is really fantastic. I have just half an hour ago, I've seen a patient who had such a big tumor of the left lung, and the lymph nodes in the middle field, in the mediastinum, were involved as well. He was lucky because he was eligible for chemoimmunotherapy, and he had received this for 3 months, and At the PET CT, he showed a very nice, good response, meaning that the tumor was shrinking and smaller. So as a consequence, we offered him operation. I have operated him 10 days ago. We have removed all of the left lung. We have removed all the lymph nodes. And the final pathological report now shows that all the tumor cells were not vital at all anymore. So they were all dead, the tumor cells. Which means that he now has a very good prognosis and a very high chance that he's completely healed.
This gives us hope. But can you tell us about another successful story about a lung cancer survivor and how he or she did it?
Yes, I can give you many examples. One of the most prominent examples is a very young lady who came to me many years ago. I would say about 15, 16 years ago. She was in the mid-30s, really young woman. And she was very sportive. She had pain here at the level of the clavicular. And she was at the orthopedic treatment for months until finally the diagnosis was given that she actually had a lung tumor which was growing into the apex of the lung. By that time, she received the combined chemo and radiotherapy as a preparation for operation. And then she underwent a very aggressive or very radical operation, resecting the upper part of the lung, resecting the ribs, resecting some vessels and everything. And the nice thing was that 2 years thereafter, the lady visited me and showed me her newborn child. And the even nicer thing is, I'm receiving every Christmas a letter from the child, meanwhile, where she writes to me, thanks me that she still has her mom. And recently she was writing, Doctor, you know, I'm intending to study medicine because I also want to help people for their life. That's, I would say, is really a success story.
And very impressive also. A very impressive story.